What if one of the most trusted exercises for building strong glutes is actually contributing to weakness in the body after the age of 50? A revelation that challenges decades of conventional fitness wisdom. For years, the prevailing advice has emphasized squats as the cornerstone for developing robust hips, legs, and a powerful backside. And to acknowledge their value, squats are indeed a beneficial exercise, neither inherently harmful nor ineffective. Yet this discussion avoids blame and instead poses a critical inquiry. What if the manner in which most individuals over 50 perform squats no longer aligns with the evolving needs of their bodies? Data from the Centers for Disease Control and Prevention reveals that falls represent the leading cause of injury-related fatalities among adults aged 65 and older. While insights from Harvard Health indicate that aging joints experience diminished shock absorption and reduced tolerance for compressive forces, particularly in the knees, hips, and lower back. And research published in the Journal of Orthopedic and Sports Physical Therapy underscores that hip instability, rather than mere leg strength, emerges as a primary indicator of balance impairments in older adults dealing with chronic lower back pain, emphasizing not weakness or inactivity, but instability as the core concern. Delving deeper, traditional squat variations, especially those executed at home, excel in engaging the large gluteus maximus muscle, but frequently overlook the gluteus medius, a crucial stabilizer essential for individuals over 50, as this muscle maintains pelvic levelness, ensures hip stability, and supports upright posture during activities like walking, turning, or single leg standing. And when it weakens, the body compensates by overburdening the lower back, stressing the knees, and gradually eroding balance, leading to unexplained hip pain during ambulation, rapid fatigue in the lower back, and increased difficulty with stairs, often misattributed to inevitable aging rather than to imbalanced training priorities. This perspective shifts the narrative from fear-mongering or exercise cessation to empowerment, highlighting that post-50 strength transcends lifting capacity to encompass balance maintenance, hip stabilization of the spine, and confident navigation of daily life free from discomfort or apprehension. Revealing that many generic exercise regimens, replete with repetitive squats, were originally tailored for youthful physiologies, not the adaptations required by maturing nervous systems, joints, and equilibrium mechanisms, signifying not a flawed body, but a call for more intelligent approaches. On the Senior Vitality channel, dedicated to fostering strength, balance, and enhanced mobility for mature audiences, we invite viewers over 50 to share their first name, age, and viewing location in the comments, cultivating a supportive community committed to incremental progress in physical well-being. And while many in this demographic maintain activity through walking or even squats, influenced by medical, media, and training recommendations touting them for glute fortification, posture improvement, and healthy aging, such guidance, though partially accurate, often neglects the physiological shifts occurring after 50, prompting the question of whether squats, presumed safest and most efficacious for glute development across ages, might inadvertently diminish stability. Unpacking this, squats predominantly activate the gluteus maximus, responsible for buttock contour and propulsion, yet they underemphasize the gluteus medius, the pivotal muscle for lateral equilibrium, pelvic steadiness during gait, and stability on inclines or irregular surfaces, where mere motion without targeted engagement equates to rote repetition, fostering compensatory patterns and heightening injury risk, as evidenced by a 2020 study in the Journal of Orthopedic and Sports Physical Therapy linking gluteus medius weakness to elevated lower back pain and fall susceptibility even among regular exercisers. Complemented by a gait and posture journal review demonstrating that conventional squats activate the gluteus medius up to 50% less than specialized low-impact lateral leg exercises. Persisting with unadapted routines results in overdependence on superficial muscles, deactivation of deep stabilizers like the gluteus medius, joint overload, and ensuing stiffness, soreness, and fatigue, eroding bodily assurance subtly until a threshold is crossed, necessitating not the abandonment of squats, but their supplementation with stabilizer-focused movements that honor joint integrity and deliver the stability squats alone cannot provide. Transitioning to practical alternatives, consider the sideline hip abduction, a deceptively simple exercise involving lying on one side and elevating the leg, often dismissed as inadequate compared to the tangible exertion of squats. Yet effort does not equate to efficacy, and in the 50s and beyond, the gluteus medius requires activation over overload, contrasting with squats' emphasis on the gluteus maximus for rising, stair ascent, or heavy lifting, as the medius safeguards pelvic alignment, hip steadiness on one leg, and prevents compensatory strain on the back and knees. Its neglect stemming from indirect training and standard routines, whereas this targeted motion engages it purposefully, supported by a 2019 Journal of Geriatric Physical Therapy study, where adults over 55 incorporating it thrice weekly achieved 28% better single-leg balance, 22% enhanced walking stability, and fewer lower back fatigue reports without weights. Building upon this, the posterior hip abduction appears similar yet diverges crucially in leg positioning and foot orientation, shifting to external rotation by placing the leg behind the torso with toes sealingward, addressing rotational forces increasingly vital with age, such as backward or twisting motions that precipitate falls like lateral slips or abrupt pivots, areas squats, walking, and gym apparatus overlook, but essential for real-world scenarios like curb descent or rearward reaches. With a 2020 clinical biomechanics study showing 37% rotational hip control gains, diminished lateral sway and gait, and superior recovery from perturbations persisting post-12 weeks in older participants. Without this, hips forfeit rotational strength, knees falter inward, spines contort, rendering pivots hazardous, but performance mirrors the prior, with the top leg rearward, toes upward for external rotation, and deliberate low lifts sans back involvement, reprogramming neural pathways for unanticipated safeguards. Advancing to standing. The hip drop and abduction counters the misconception that daily walking suffices for balance, as ambulation advances linearly while frets manifest laterally, where falls predominate. Envisioning the pelvis as a platform upheld by the contralateral gluteus medius during single-leg phases, its failure inducing drops, tilts, inward knee shifts, and instability, unaddressed by squats or presses, yet this drill rectifies it. Per a 2018 American Journal of Sports Medicine study yielding pelvic symmetry, proprioceptive, and single-leg stability improvements in those over 55, translating to practical proficiencies like curb navigation or unassisted dressing. Deficient control prompts hip misalignment, knee compensation, balance erosion, and eventual activity avoidance spiraling to dependency, but initiation involves wall-adjacent standing, weight on one leg, opposite hovering forward with inward toes, lateral swing allowing standing hip drop, then glute-powered recovery, emphasizing bilateral tension and unhurried glute dominance to affirm cerebral command over posture, culminating with standing hip extension and external rotation. This unassuming backward leg swing with twist outperforms squats by replicating authentic instability and retraining recovery. Diverging from linear squats amid life's rotational demands like rear reaches or pivots. Integrating gluteus medius with rotators, core, and spine. As a 2021 gait and posture study documented 36% instability reaction enhancements, spinal stabilizer activation, and pelvic symmetry over 8 weeks sans weights. Untrained, backward steps or twists invite vulnerability, exemplified by driveway reversals or object retrievals precipitating stumbles despite prior fitness, but execution requires sidewall stance, weight shift, rearward leg with outward toes, gentle back swing with subtle torso rotation, fostering cross-hip spinal tension and concise, stable arcs to cultivate rotational mastery over mere load-bearing. Reflecting broadly, diligent efforts in squats and activity may have misaligned with post-50 realities, where strength pivots to neural muscle reconnection, stabilizer revival, and reclaimed autonomy in mundane motions sans gym necessities. Through these unpretentious yet truthful exercises that accommodate current physiology, empowering rather than alarming, urging commencement from modest origins like floor-based lifts, as incremental actions yield enduring mobility, with senior vitality advocating likes for visibility, shares for outreach, and subscriptions for ongoing evidence-based strategies in sustaining vigor and self-reliance.